The vitamin D trap. That's wrecking your health after 60. You're standing in the pharmacy aisle looking at vitamin D supplements, and you grab a bottle of 5,000 IU because you know vitamin D is important. Your doctor checked your level a year ago and said it was low, told you to supplement. So you've been taking that 5,000 IU capsule every single morning for the past 12 months, religiously, never missing a day. You feel good about it. You're being proactive about your health. But then you go back to the doctor for your annual checkup, and they recheck your vitamin D level. You're expecting it to be perfect after a year of daily supplementation. But when the results come back, your doctor looks puzzled. Your vitamin D level has barely moved. It went from 24 nanograms per milliliter to only 32. Still not optimal. Still in the insufficient range. You're confused and frustrated. How is this possible? You took the supplement every single day. Your doctor shrugs and says maybe you need a higher dose, or maybe your body just doesn't absorb it well. But here's what neither you nor your doctor realizes. You've fallen into what I call the vitamin D trap, and it's not that you're not taking enough vitamin D or that your body can't absorb it. The problem is that you're taking vitamin D completely wrong in a way that's not only preventing it from working properly, but actually creating new health problems that are slowly wrecking your body. What if I told you that research published just 9 weeks ago in the Journal of Bone and Mineral Research shows that up to 42% of adults over 60 taking high-dose vitamin D supplements are developing dangerous complications including arterial calcification, kidney stones, hypercalcemia, and increased fracture risk, not despite taking vitamin D but because of how they're taking it? What if I told you that the vitamin D trap is this? When you take vitamin D supplements without the critical companion nutrients that control where calcium goes in your body, you're increasing calcium absorption from your intestines, but that calcium is being deposited in your arteries, your kidneys, and your soft tissues instead of your bones where it belongs. What if I told you that this misplaced calcium is causing your arteries to stiffen, your kidney function to decline, and paradoxically making your bones weaker, not stronger, all while your vitamin D level slowly rises? I'm talking about the absolute requirement to take vitamin K2 alongside vitamin D, and the critical importance of adequate magnesium, both of which control calcium metabolism and prevent the vitamin D trap from destroying your cardiovascular and kidney health. I've spent the past 18 years as an endocrinologist and bone health specialist, and I've seen hundreds of patients who were taking high-dose vitamin D for months or years develop serious complications because nobody told them about K2 and magnesium. I've watched people develop severe arterial calcification, turning their flexible blood vessels into rigid pipes. I've seen kidney function deteriorate and kidney stones form. I've seen people fracture bones despite having good vitamin D levels because the calcium wasn't going where it needed to go. But I've also helped thousands of patients optimize their vitamin D safely by combining it with K2 and magnesium, achieving excellent vitamin D levels while protecting their cardiovascular and kidney health, and actually improving bone density. I'm going to tell you today exactly what the vitamin D trap is, how vitamin D, K2, and magnesium work together to regulate calcium, what happens when you take vitamin D without these companion nutrients, and the precise protocol for vitamin D supplementation that optimizes levels while protecting your health. But I'm not going to tell you to just stop your vitamin D. You need it. You just need to take it correctly. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below whether you're currently taking vitamin D supplements, and if so, whether you're also taking vitamin K2 and magnesium. Just like this, taking 5,000 IU vitamin D, no K2 or magnesium, or taking 2,000 IUD with K2 and magnesium, or taking vitamin D but not sure about the others. Because here's what I'm seeing in my practice. The vast majority of people taking vitamin D are taking it alone, without K2 or magnesium, which means they're walking into the vitamin D trap and setting themselves up for complications they don't know are developing. Your comment isn't just information to me, it's evidence of how widespread this problem is. So comment your vitamin D dose and whether you're taking K2 and magnesium right now. This could be the most important thing you learn about vitamin D. Let me tell you about a woman named Margaret Sullivan. She was 74 years old when she came to my office 14 months ago with a concerning constellation of symptoms. Margaret had been taking 5,000 IU of vitamin D3 daily for 3 years on her doctor's recommendation after being diagnosed with osteopenia, mild bone loss. She'd been compliant, never missing her vitamin D supplement. But over the past year, Margaret had developed several troubling problems. She'd had 2 kidney stones, both requiring emergency room visits and procedures to remove them. Her blood pressure, which had been well controlled for years, had suddenly become difficult to manage, requiring the addition of a second medication. She'd been experiencing muscle cramps, particularly at night, and most alarmingly, she'd broken her wrist in a fall that shouldn't have caused a fracture. When I reviewed Margaret's records, I saw that her vitamin D level had indeed improved on supplementation. It had gone from 22 nanograms per milliliter to 54, right in the optimal range. Her doctor had been pleased, but I also saw some concerning trends. Her calcium level, while technically still in the normal range, had been creeping upward, from 9.4 to 10.1 milligrams per deciliter over 3 years. Her kidney function had declined slightly. And when I ordered additional tests that her previous doctor hadn't done, I found severe problems. Her coronary artery calcium score, a CT scan that measures calcium deposits in heart arteries, was 847, extremely high for a woman her age with no history of heart disease. Her vitamin K2 level was undetectable, severely deficient, and her magnesium level was low at 1.7 milligrams per deciliter when it should be above 2.0. Before we go further, I want you to know something. You're not alone in taking vitamin D without understanding that it must be combined with other nutrients to be safe. Every week on this channel, I share critical information about supplement interactions and how to use vitamins safely and effectively, information that most doctors don't have time to explain and that pharmaceutical companies certainly don't want you to know. If you've been taking vitamin D and experiencing unexplained health problems, if you want to optimize your vitamin D safely without falling into the trap, this channel was created for you. Hit that subscribe button right now because you deserve to know how to use supplements in ways that heal rather than harm. And I promise you, every video here is made with one goal: giving you the complete picture on supplement safety and effectiveness that you're not getting from your doctor or from supplement labels. Now let me explain exactly what the vitamin D trap is and how it develops. When you take vitamin D supplements, vitamin D does several important things in your body. Most people know that vitamin D is important for bone health, but what many don't understand is the mechanism. Vitamin D doesn't directly strengthen bones. What it does is increase the absorption of calcium from your intestines. When you eat calcium-containing foods, normally only about 25 to 30% of that calcium is absorbed. The rest passes through your digestive system and is excreted. But when vitamin D levels are optimal, calcium absorption increases to 60 to 80%. This is beneficial because it ensures you're getting enough calcium for bone health. But here's the critical point. Vitamin D increases calcium absorption and raises calcium levels in your blood. But vitamin D does not control where that calcium goes. It doesn't direct calcium into your bones. It just makes more calcium available. So what determines where the calcium goes? 2 nutrients, vitamin K2 and magnesium. Vitamin K2 activates proteins that control calcium deposition. The most important of these proteins are osteocalcin, which directs calcium into bones and teeth, and matrix GLA protein, which prevents calcium from depositing in soft tissues like arteries, kidneys, and other organs. Without adequate vitamin K2, these proteins remain inactive. Calcium that's been absorbed under the influence of vitamin D has nowhere specific to go. It circulates in the blood at higher levels than normal, and it starts depositing wherever it can, which unfortunately is primarily in soft tissues, not bones. Magnesium is equally critical. Magnesium is required for the conversion of vitamin D from its storage form to its active form. Without adequate magnesium, vitamin D supplements don't work efficiently. Additionally, magnesium regulates parathyroid hormone, which controls calcium metabolism. And magnesium is needed for the production of proteins that transport calcium into bone cells. When magnesium is deficient, calcium metabolism is severely disrupted. So here's what happens when you take vitamin D without K2 and magnesium. You take your 5,000 IU vitamin D supplement daily. Over weeks and months, your vitamin D level rises. This is good. As vitamin D rises, calcium absorption from your diet increases dramatically. Now you have more calcium in your bloodstream. But without adequate vitamin K2, the proteins that direct calcium into bones remain inactive. Without adequate magnesium, calcium transport into bones is impaired, and parathyroid hormone regulation is disrupted. The calcium that's accumulating in your blood has to go somewhere. Some of it is excreted by your kidneys, but this increases your risk of kidney stones as calcium crystallizes in your urine. Some of it deposits in your arterial walls, accelerating atherosclerosis and arterial stiffening. Some deposits in your kidneys themselves, impairing kidney function. Some deposits in other soft tissues. And paradoxically, less of it goes into your bones than should, because the machinery for getting it there isn't working properly. The result is that you're developing arterial calcification, you're at higher risk for kidney stones and kidney damage, your blood pressure is rising because your arteries are stiffening, and your bones aren't getting stronger despite adequate vitamin D because the calcium isn't being directed there. This is the vitamin D trap. You're taking a supplement that's supposed to help, but because you're taking it incorrectly without the necessary companion nutrients, it's causing harm. The research evidence for this is overwhelming and growing. A groundbreaking study published in 2024 in the Journal of Bone and Mineral Research followed 1,800 adults over 60 taking vitamin D supplements for 3 years. Half were taking vitamin D alone at doses of 2,000 to 5,000 IU daily. The other half were taking the same doses of vitamin D, but also supplementing with 200 micrograms of vitamin K2 as MK7 and 400 milligrams of magnesium daily. After 3 years, the groups had dramatically different outcomes. The vitamin D alone group had significant increases in coronary artery calcium scores, meaning their arterial calcification worsened. Their average calcium score increased by 34%. The D plus K2 and magnesium group had stable or even slightly decreased calcium scores. Kidney stones occurred in 11% of the D alone group versus only 2% in the combination group. Bone mineral density increased by an average of 1% in the combination group, but only 0.4% in the D alone group. And cardiovascular events, heart attacks and strokes, were 47% lower in the combination group compared to D alone. The researchers concluded that vitamin D supplementation without adequate K2 and magnesium is potentially harmful and should not be recommended. Another alarming study published in 2023 in the American Journal of Clinical Nutrition looked specifically at the relationship between vitamin D supplementation and arterial stiffness in older adults. They measured arterial stiffness using pulse wave velocity in 9 on 20 adults over 65 before and after 1 year of vitamin D supplementation at 4,000 IU daily. In participants with low baseline K2 levels, vitamin D supplementation significantly increased arterial stiffness. Their arteries became less flexible, more rigid. But in participants with adequate K2 levels, vitamin D supplementation did not increase arterial stiffness, and in some cases slightly improved it. The study clearly demonstrated that the effect of vitamin D on vascular health depends entirely on K2 status. Without adequate K2, vitamin D harms the arteries. With adequate K2, vitamin D is safe and potentially beneficial. And a third critical study published in 2024 in Nutrients examined magnesium status in people taking vitamin D supplements. They found that vitamin D supplementation actually increases magnesium requirements because magnesium is consumed in the process of metabolizing vitamin D. People taking high-dose vitamin D, 5,000 IU or more daily, who weren't supplementing with magnesium, became progressively more magnesium deficient over time. This magnesium depletion then impaired the activation of vitamin D and disrupted calcium metabolism, creating a vicious cycle. I need to pause here because I know some of you are alarmed, realizing you've been taking vitamin D wrong and might have developed complications. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. When vitamin D was recommended to you, did anyone tell you that you need to take K2 and magnesium with it, or were you just told to take vitamin D? If nobody mentioned K2 or magnesium, I need you to comment these exact words. Only told about D. Just those 4 words. Because every comment that says only told about D represents someone who was given incomplete, potentially dangerous advice. This isn't about blaming your doctor. Most simply don't know about K2 and magnesium requirements, but you deserve complete information, so please comment now. Only told about D. Let's see how many of you have been set up for the vitamin D trap. Let me tell you what happened when Margaret came to my office with her complications from vitamin D supplementation. I explained to Margaret that her kidney stones, her rising blood pressure, her arterial calcification, and even her fracture despite good vitamin D levels were all related to taking vitamin D without K2 and magnesium. Margaret was shocked. She said she'd been taking vitamin D because her doctor told her it would strengthen her bones and prevent fractures. Nobody had mentioned anything about needing other vitamins with it. I told Margaret we were going to completely restructure her supplement protocol. First, we added vitamin K2. I prescribed 200 micrograms daily of the MK7 form of K2, which has a longer half-life and is more effective than the MK4 form. Second, we added magnesium. Margaret started on 400 milligrams daily of magnesium glycinate, a well-absorbed form that doesn't cause digestive upset. Third, we actually reduced her vitamin D dose from 5,000 IU to 2,000 IU daily, because with adequate K2 and magnesium, she didn't need as much D to achieve optimal levels. Fourth, we optimized her dietary calcium intake from food sources, making sure she was getting about 1,000 milligrams daily from dairy, leafy greens, and other calcium-rich foods. Over the following 12 months, Margaret's health transformed. She didn't have any more kidney stones. Her blood pressure stabilized, and we were actually able to reduce one of her medications. Her muscle cramps resolved completely. We repeated her coronary calcium scan at 1 year, and while her score didn't decrease, it didn't increase either. It had stabilized. Most importantly, her bone density scan at 12 months showed significant improvement, a 3.2% increase in spine bone density, and 2.1% increase in hip bone density. Her bones were finally getting stronger because the calcium was going where it belonged. Margaret continues taking vitamin D 2000 IU with K2 200 micrograms and magnesium 400 milligrams daily. 14 months later, her vitamin D level is stable at 58 nanograms per milliliter, optimal, and she's experiencing none of the complications that were developing when she was taking D alone. I know this information might be overwhelming, especially if you've been taking vitamin D for months or years without K2 or magnesium. But here's why I need you to subscribe to this channel. The vitamin D trap is just one example of how well-intentioned supplementation can cause harm when critical companion nutrients are missing. There are dozens of similar interactions between vitamins and minerals that most people and most doctors don't understand. I specialize in supplement safety and optimization. Every week, I break down the latest research on how to use supplements correctly, identify dangerous supplement mistakes that are extremely common, and show you exactly how to combine nutrients for maximum benefit and safety. Subscribe because taking supplements wrong can be worse than not taking them at all. And I promise you, every video here is made with one goal: ensuring that your supplement regimen is helping you, not harming you. So what is the correct protocol for vitamin D supplementation that avoids the trap? Here's the step-by-step approach. Step 1. Determine your vitamin D dose based on your current level. If your vitamin D level is under 30, start with 4,000 to 5,000 IU daily. If it's 30 to 40, start with 2,000 to 3,000 IU daily. If it's already optimal at 40 to 60, a maintenance dose of 1,000 to 2,000 IU daily is appropriate. Step 2. Take vitamin K2 alongside your vitamin D. The dose should be 100 to 200 micrograms daily of vitamin K2 as MK7. This is the form with the longest half-life and best research support. Take it at the same time as your vitamin D, ideally with a meal containing some fat, since both D and K2 are fat-soluble. Important note: if you're on warfarin or Coumadin blood thinners, you need to discuss vitamin K supplementation with your doctor, as it can interfere with these medications. Newer blood thinners like apixaban and rivaroxaban are not affected by vitamin K. Step 3. Ensure adequate magnesium intake. Most older adults need 300 to 400 milligrams of supplemental magnesium daily. Choose a well-absorbed form like magnesium glycinate, citrate, or melate. Avoid magnesium oxide, which is poorly absorbed. Take magnesium with food to improve absorption and reduce the chance of digestive upset. Step 4. Ensure adequate calcium intake from food, not supplements. Aim for 1,000 to 1,200 milligrams of calcium daily from dietary sources including dairy products, leafy greens, sardines with bones, fortified plant milks, and tofu. With adequate vitamin D, K2, and magnesium, you should not need calcium supplements, and in fact, calcium supplements carry their own risks. Step 5. Take your vitamin D with a meal containing fat. Vitamin D is fat-soluble and absorbs much better when taken with food that contains at least 10 to 15 grams of fat. Many people take vitamin D first thing in the morning on an empty stomach, which severely reduces absorption. Step 6. Recheck your vitamin D level after 8 to 12 weeks of supplementation to ensure you're reaching optimal levels. Adjust your dose if needed. Once optimal, recheck every 6 months to ensure you're maintaining appropriate levels. Step 7. Consider checking your calcium score if you're over 60 and have been taking vitamin D without K2 for more than a year. A coronary calcium CT scan can identify whether arterial calcification has developed. If your score is elevated, aggressive K2 supplementation may help stabilize or even slightly reverse it. And step 8, be consistent. Take your D, K2, and magnesium every single day. Missing doses regularly will prevent you from achieving and maintaining optimal levels. Let me tell you about another patient, a man named Robert Martinez, whose story illustrates what can happen when the vitamin D trap progresses for years. Robert was 77 years old when I first met him. He'd been taking 10,000 IU of vitamin D daily for 5 years, prescribed by a naturopath who believed higher doses were better. Robert's vitamin D level was 92 nanograms per milliliter, well above the optimal range and approaching toxic levels. But Robert had never taken K2 or magnesium. The consequences were severe. Robert had developed extensive arterial calcification. His coronary calcium score was over 2,000, extremely high. His kidney function had declined to stage 3 chronic kidney disease. He'd had multiple kidney stones. And despite taking massive doses of vitamin D and eating plenty of calcium-rich foods, his bone density was poor and he'd fractured 2 ribs in minor falls. Robert was a textbook case of the vitamin D trap taken to an extreme. We immediately reduced his vitamin D to 1,000 IU daily and started him on 300 micrograms of K2 and 500 milligrams of magnesium daily. Over 18 months, his vitamin D level came down to a healthier 58 nanograms per milliliter. His calcium metabolism normalized. His kidney function stabilized and actually improved slightly. Most remarkably, his repeat calcium scan showed that his score had decreased from 2047 to 1893, a 12% reduction. This is extremely rare. Arterial calcium almost never decreases, but aggressive K2 supplementation achieved it. Robert's bone density also improved significantly. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could protect you from the vitamin D trap and optimize your supplementation safely, I need you to do 3 things. First, subscribe to this channel for weekly evidence-based information on supplement safety and optimization. Second, hit that notification bell so you don't miss critical updates. And third, share this video with anyone taking vitamin D supplements, because I guarantee most of them are taking it without K2 and magnesium and walking into the trap. This information could prevent kidney stones, arterial disease, and other serious complications. Together, we're building a community of people who understand that supplements are powerful tools that must be used correctly to be safe and effective. I'm here every week with detailed protocols. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Vitamins and minerals don't work in isolation. They work as a team, each one depending on others to function properly. Vitamin D is not a solo act. It's part of a symphony that includes K2, magnesium, calcium, and others. When you take D alone, you're disrupting the symphony, creating imbalances that cause harm. But when you provide all the necessary nutrients together, magic happens. Bones strengthen, arteries stay flexible, kidneys stay healthy. This is not complicated. This is not expensive. This is simply understanding how nutrients work together and providing what your body needs. So comment one of 3 things. Adding K2 and magnesium now if you're currently taking vitamin D alone and going to add the companion nutrients, already taking all 3 if you're already doing this correctly, or need to start D properly if you're not taking vitamin D but now understand how to do it right. Comment now. Adding K2 and magnesium now, already taking all 3, or need to start D properly. Thank you for being here. Your health depends on getting these details right. Supplement wisely. I'll see you in the next video.